Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Do you have shortness of breath, tightness in your chest, coughing or wheezing episodes? You might have a condition called asthma. Joining us to talk about this is Dr. Stephen Zhao. He is a pulmonologist and critical care specialist with the Scripps Clinic Medical Group in La Jolla, California. Doctor, thanks so much for being with us.
My pleasure.
So in a little bit more detail, what is asthma?
So asthma is a pretty common lung condition that actually involves primarily the airways of the lungs. So the airways are these little tubes that you can see that bring air from their environment all around you down to the actual lung tissue where gas exchange happens. And asthma fundamentally is a problem with three sort of domains. Number one, there's inflammation in the airways. Number two, that inflammation can lead to what we call bronchospasm or narrowing of these airways. And number three, there's an increase in sensitivity to environmental triggers that can bring on these episodes of airway inflammation and narrowing. And all of these together can lead to the typical symptoms of coughing, of wheezing, of shortness of breath, or chest tightness.
And who is most at risk?
So asthma is a pretty common condition. Something like 1 in 12 Americans have asthma. So it's very likely that somebody in your family or your circle of friends has this problem. It can affect all kinds of people, who are young with no other medical problems, or people who are at increased risk due to a history of smoking or being overweight or just having exposure to things in the environment that can trigger their asthma.
Exposure to things like what?
So some of the most common things are environmental triggers such as smoke, which can come from both just what we think of as cigarette smoking, but also from other devices such as vapors, electronic cigarettes, also from the environment. People in more urban settings have more smog and pollution in the air. Some other really common triggers for asthma include pollen and just sort of seasonal environmental allergies. So things like animal dander, grass or tree pollen, strong smells or perfumes even can all be triggers to set off asthma.
Is there a genetic component? If one of your parents had it, are you more likely to have it?
Yeah, there definitely is. It is something that oftentimes can run in families. It doesn't necessarily mean that you will have it if your family has it, but it does increase your likelihood of having this.
And what about asthma in children versus adults?
So the vast majority of asthma does get diagnosed early in childhood, often manifesting as what seems to be recurrent episodes of respiratory tract infections, frequent episodes of bronchitis, things like that. About 3/4 of the time, it is diagnosed in childhood. With that said, that leaves 25%, which is a pretty good number of people who get diagnosed later in life. It can often present with the same sort of symptoms, whether you're young or you're old. The challenge in diagnosing it sometimes becomes a little bit more difficult for people who are adults because they often have more other potential causes for feeling short of breath or coughing.
As far as the symptoms are concerned, let's go into a little bit more detail because there's lots of things that can make you cough or have shortness of breath.
Yeah, so asthma, the diagnosis of asthma can be a little bit tricky for that very reason. There are often many other things, both lung conditions, other heart conditions, or just other diseases of the body in general that can cause these symptoms. Some of the more typical hallmarks of asthma is that triad, that combination of coughing, of wheezing, and of shortness of breath. But there are also a couple other clues that can point towards asthma as a diagnosis. Typically, asthma is more sporadic in the sense that you might have asthma symptoms one day and be feeling totally fine the very next day. Often it can be triggered by some of these things that we mentioned earlier, as far as environmental smoke or pollen or other things that can trigger allergies or strong smells.
And talk about the different types of asthma. What triggers these different episodes?
There's actually a lot of potential triggers for asthma, and that kind of helps us differentiate the different types of asthma. There's sort of general run-of-the-mill asthma, which is most commonly felt to be sort of allergic asthma, where people's lungs are set off by something in the environment, such as pollen. There's also what we call occupational induced asthma, where something about a person's work environment can be affecting their lungs and causing them to have asthma symptoms, particularly at work. There's also exercise induced asthma, where people can have no symptoms normally, but if they try to exercise, particularly in the cold air, that can be enough to trigger bronchospasm. And lastly, there's a category of asthma called aspirin exacerbated asthma, where people can have a sensitivity to medications such as aspirin or ibuprofen.
When you talk about asthma with regard to a work environment, what type of work environment are you talking about? Do you have to be working around chemicals?
Not necessarily. That's a really great question. Again, there's such a wide spectrum of things that can bring out asthma. So people who are exposed to things like chemicals, fumes, manufacturing, that can certainly set off asthma. But at the same time, I have some patients who are just have their asthma brought upon by just the smell of something in their work environment, even just strong flowers or a coworker who wears a strong perfume. These are all things that can bring out asthma.
So how do you treat asthma?
So recalling back what asthma fundamentally is a problem of airways inflammation and narrowing of the airways, bronchospasm. So keeping that in mind, that's what kind of helps us know how best to treat asthma. The goals of therapy with asthma are to reduce airway inflammation and to relax the smooth muscles in your airway to help reduce that narrowing and help reduce those symptoms of coughing, wheezing, and shortness of breath. The main category of medications for asthma involve inhalers. Inhalers are simple devices, there's a wide variety of them that are all used to deliver a medication through your mouth and into your lungs. So I can show you some examples here. These are all different brands and different types of inhalers that all work to do the same thing. So you might see different people have different kinds of inhalers that look different, but their job is all the same, which is to give you a dose of medication that you breathe in into your lungs. The specific inhaler may have different combinations of medications, but the overarching goal is, again, to reduce inflammation and open up the airways in your lungs.
Are there ways to prevent an asthma attack?
Yeah, so the best way to treat asthma is to avoid the triggers. So it's really important for patients who have asthma to be very aware of what things can set their lungs off. So whether it's something seasonal, whether it's a certain kind of environment or weather, or something in their workplace or something that they can identify, it's really important to know what those things are to try to avoid them as much as reasonably possible. Beyond that, it's really important to stay on the inhalers that your doctor recommends. There are a number of different kinds of inhalers, and some inhalers are meant to be used purely on an as-needed basis when you develop symptoms, but many other inhalers need to be taken on a daily basis for them to have effect. So the best way to prevent having a flare-up or an exacerbation of your asthma is to make sure you're using the medications that are going to help your lungs.
If you're having these symptoms, when should you say, I need to go see a doctor? And then after you've been diagnosed, how often should you check in with your doctor to keep the asthma under control?
So anybody who has ongoing symptoms of shortness of breath or wheezing or coughing should get evaluated by a doctor to see what the underlying cause is and get them started on the right treatment. For somebody with a confirmed diagnosis of asthma, they should get checked out, depending on how severe their symptoms are, anywhere from once every couple months to a couple times a year. It really just depends on how they're feeling and how effective their medications are. We want to make sure that we're matching the patient with the right medications.
If you don't get control of your asthma, what can happen in the long term?
So there are a number of potentially serious consequences of not having your asthma being adequately treated. So in the short term, people can experience what we call flares or exacerbations of their asthma, where their symptoms can dramatically worsen over the span of a few hours to a few days. In those cases, they can have really quite a lot of trouble with their breathing, and they often need to be treated in an urgent care or emergency room setting to really expedite their treatment and get them all the intensive treatment they might require. Over the long term, asthma can cause some long-term damage to the airways. As we remember, the airways are the little tubes that connect your lung tissue to your throat and to the surrounding world. And over time, that narrowing and bronchospasm and inflammation of the airways can become permanent, and you can have permanently narrowed airways that can affect the way you breathe on an ongoing basis. So it's important to get treated.
Any final thoughts, doctor?
Yeah, so it's just really important to get checked out for asthma because it is such a common disease. And it's very possible that a lot of people are living their lives not recognizing that they do have asthma. It's important to get checked out and get diagnosed. And once you're diagnosed, to follow the recommendations from your doctor. Make sure you're taking all the inhalers that you need to be taking to make sure your disease is well controlled.
And when you go see your doctor, are you talking about going to see your primary care physician, or are you talking about going to see someone like a lung specialist?
So, depending on the situation, oftentimes the primary care physician is very comfortable managing patients with asthma. Sometimes, when it gets to be a little bit more complex or they're having a little bit more trouble controlling their symptoms, it's a good idea for a patient to see a specialist, whether it's a lung specialist or an allergy specialist. These are all specialists that have expertise in dealing with asthma.
Dr. Zhao, thanks so much for taking the time to be with us. We really appreciate it.
Of course, my pleasure.
If you want more information on asthma, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.